Our talk today is part 3 of a lecture series on the immune system. Our speaker is Dr. Olixn Adams. Olixn is a board-certified practitioner of family medicine and practices holistic medicine at Southern Cross Hospital in Bandon, Oregon. He uses traditional osteopathic medicine when caring for his patients in the clinic, hospital, and emergency room. He's a faculty member of the Biodynamics of Osteopathy program and lectures internationally, teaching osteopathic medicine to physicians from around the world. Dr. Adams synthesizes the principles of Ayurvedic medicine and osteopathic medicine to provide a deeper understanding of physiology, spirituality, and the wholeness of life as it pertains to health, healing, and well-being. So before we begin, I'm just going to say a short Vedic prayer. It's the teacher-student prayer. Feel free to chant along with me if you know the prayer. Om Sahana Vavatu, Sahana Bhunaktu, Saha Viryam Karavavahai, Tejasvi Navadhitamastu, Ma Vidvishavahai. Om Shanti Shanti Shanti. Thank you so much, Olixn, for being with us today. I'm going to hand it off to you.
We're good to go. Okay. Good morning, everybody. It's nice to join you. Nice to see everybody. This lecture was titled The Anatomy of Healing and the Celestial Pharmacy. So we could ask ourselves, what is healing? What does it mean to heal? What is the process of healing? We could say healing is the recreation of wholeness. Healing is a movement towards wholeness. And of course, true wholeness is a manifestation of the true self, the Atma, soul. So healing is a movement towards the true self. I like to look up the origin of words because it informs us a lot about the true meaning and the essence of the word. And the oldest language on the planet is Sanskrit. And if we look at the Sanskrit word for health, it's savista. Excuse my pronunciation, it's not ideal, but it's svadista, which actually means to be established in oneself. And healing is apoha, which means removing the doubts. So removing the doubts and establishing in oneself, in one's true self, is what healing is. It's a movement to wholeness. Well, we could ask, what is actually moving us to wholeness? What's creating this movement? Where is this movement coming from? Every spiritual tradition on the planet that I've read talks about this breath of life, prana, or prana Krishna, or Mahaprana, the great prana. There's this movement, there's this breath of life that's coming out of the silence, moving into creation, creating, sustaining, and destroying all of life all the time. So there's this natural movement. There's something that's passing through us, creating us, sustaining us, and moving us towards wholeness. Now these forces, this movement, is with us from the moment of conception. These are the same forces that organize the growth and development of the embryo, the fetus, the newborn. So these forces of growth and development that is coming from the breath of life are with us from conception. And they don't just disappear, they don't just go away. That wouldn't be consistent with life. So once growth and development, once the growth is completed, the forces stay with us and they become the healing forces in our life. They become the energies and the forces and the movement that moves us into wholeness. They're with us all the time. So the job of the doctor then, the job of the physician, is to remove the obstructions that are preventing a natural movement and to synchronize the patient with these motions and these movements of life. Giving these talks by Zoom is an interesting phenomenon, interesting way to present the information, because there's natural pauses all the time in life. And if we're going to get synchronized with the breath of life, with this prana Krishna, we really need to be attuned to the pauses as they arise in life. And they happen all the time. So sometimes they happen in the middle of a lecture. And if we're to really honor the teachings that we're trying to present, we would need to pause. And those pauses sometimes on Zoom can be a little awkward. When we're live and in person, we're feeling the pause together and honoring the pause together. And it's really beautiful. But on Zoom, it's a little awkward, but sometimes we're going to have a pause anyways, because when it comes, we have to honor it. It's not because I forgot what to say or don't know what to say or do. Rather honoring the pause, which is natural to life. Pauses arise all the time. And they're very important to synchronize with and to honor, because that's what puts us back in relationship with the breath of life, with prana Krishna, with Mahaprana, with the great breath. The pauses are what resynchronizes us with life, which then gives us the tempo of life, which then gives us the capacity to heal. And we said healing is the movement towards wholeness, towards the true self, where we can actually rest. So that's a little bit about the concept or the principle of healing through the view of how the word originally came to be through the Sanskrit language. I was speaking with a Sanskrit scholar recently, and he told me that the language may have arisen as the rishis and the saints and sages observed creation coming out of the silence, observing the movement of life, observing form coming into creation, the sound that form made as it was created is the sound that they assigned to the word. That became the word. So the Sanskrit word for any phenomenon, shape, form, may be the actual sound that the rishis were observing that form made as it came into creation out of the silence. It's really beautiful to think about in that way. So the word is being supported by the breath of life. It's floating on the breath of life, and it's leading us back to its origin. So when we say the word, it brings us into a relationship with the phenomenon, brings us into a deeper understanding, which is why the Sanskrit chants are so powerful, such as the one that Rosa shared this morning. They lead us into a deeper relationship with life and with the prana. So this lecture was titled The Anatomy of Healing. Anatomy is an interesting word that actually causes a lot of trouble. And let me explain what I mean by that. Anatomy in the translation, in the English translation, if you look at Webster's dictionary, it refers to the structure of the human organism, the study of the structure of the human organism. Well, in reality, the human being doesn't have a structure. It has a form. It has physiology, but there's no structure. Structure would be like a chair or a table or a building or a car or a house. That has structure. It doesn't change shape and form. That's not the human body. That's not the human organism. The human organism is a constantly changing form, shape, and physiology. It's always changing in shape and form. And if we think of our body as a rigid form and structure, it'll become rigid. As you think, so you are. As your attitude, so are your results. So if we think of the human body in terms of anatomy and a structure or a form that's rigid, it actually leads us away from the essential truth of who and what we are. The Sanskrit word for anatomy is sarira, S-A-R-I-R-A, sarira, which actually means to cut into pieces. So the ancient physicians weren't seeing anatomy as a structure. They were trying to use it to describe in detail what they were seeing in surgery and in dissection. So let's get away from this idea of a rigid structure for the human body, because it causes a lot of problems and actually slows down our healing process. The body is 70% water, so it's much more fluid than structure. It's much more space and fluid than structure. Rosa, if you could pull up that first picture. Yeah, that's a beautiful picture that is to help us get this sense of the fluid nature of the body. So we have a picture on the left of the cells, and there's so much space between the cells. That's all protoplasmic fluid. It's not structure, it's not rigid, it's protoplasm. And then the picture on the right really depicts or gives a sense that there are these pranic channels that are flowing through and moving through the fluid. So you have mostly fluid and space, and then the flow of prana flowing through all of that, the flow of oxygen, the movement of the nerve channels. So you have all these channels that are moving through this very fluid-like nature. And it's mostly protoplasm. It's not water. It's more like protoplasm. Protoplasm, in Webster's dictionary, describes it as the first moldable substance that can hold a form. The first moldable substance that can hold a form. So we're mostly a moldable substance that can hold a form. And we're designed for that form to change all the time. We're not made to be a single rigid form. So the breath of life is passing through everything as one substance, and it brings the image of who we are in the moment and imprints that image in the cerebral spinal fluid. We talked about that in previous lectures in the third ventricle, the cave of Brahman. The breath of life passes through, brings an image of who we are in the moment. That image is imprinted into the cerebral spinal fluid and then disseminated throughout the entire organism via the pranic channels, the nadi channels, which there's 76,000, and the nerve channels, the neurotrophic flow. We're a moldable substance, and we're being given our identity, our form, our shape in the present moment, moment to moment, breath to breath. We aren't a rigid structure. This rigidity, this idea of a fixed identity, is part of the disease process. And part of the healing, this movement towards wholeness, requires a fluidity, a movement that's in harmony with the movement of life. So let's talk a little bit about the physiology of health and the physiology of disease and illness. We can take that picture down, Rosa. Thank you. Great. I think we're zeroed in on you now, which is nice. Your picture looked better. Okay, so let's talk a little bit about the physiology of the health, the disease process, and the healing process. The human organism is a body, a mind, and a soul. It's not just a physical form. So we have this trinity. And you see it in many of the healing arts. And it's a real thing. There's a body, a mind, a soul. There's vata, pitta, kapha. You could also say tissue, fluid, and potency. We talked about how much fluid there is. So you could say there's tissue. We've talked about the 7 types of tissue, which is denser. So there's a tissue, there's a fluid or a protoplasm, and then there's this bioelectric energy that's passing through everything. So we could talk about it in that sense. Or we could say a biochemical energy or a biomechanical energy for the tissue, a biochemical energy for the fluid, and a bioelectric energy for the prana. You could say there's a physical body, an astral body, and a causal body. There's this trinity, and it can be expressed in different ways and viewed in different ways. But it's an essential truth to life that there is this trinity. There is a body, a mind, and a soul, tissue, fluid, and a bioelectric field, with the prana passing through everything, creating, sustaining, and bringing the loving intelligence. Now, these 3 divisions that we're talking about, when we're healthy, aren't really divisions. They're made and designed to be one function. There's not supposed to be a body, mind, soul. It's body, mind, and soul as one unit of function, which is yoga. Yoga means union of body and soul. So one unit of function, body, mind, soul, tissue, fluid, bioelectric field, functioning as one. So everything's going along nicely. There's this beautiful physiology, which is the incarnation of love. And there's all this physiology happening, metabolism, fire, bioelectric activity, food digested, creating different types of energies. All of these beautiful things are highly orchestrated, organized, and intelligent. Organized by the breath of life, by this prana that's passing through everything. So everything's going along nicely, and then something happens. Maybe there's a slip and a fall, and you injure your arm, or there's a sudden traumatic event in some type of a psychological or emotional stress, or some bad food is ingested, or a virus gets into the organism and is able to exploit a vulnerability and a weakness. So now we have some type of process that has disrupted the normal physiology and the normal flow of the prana. And what happens is we end up with a lamination. Tissue, fluid, and the bioelectric field separate a little bit. One of the three can completely separate, or two of the three, or all three. There's a lamination that occurs. And the osteopathic physicians, when they put their hands on the body, on the patient, they're sensing for this, they're listening for this, because this is giving us part of our evaluation of what's going on in the patient. Also, the Ayurvedic physicians, when they're listening to the pulses, they're picking up the different information of tissue, fluid, and potency. Are they functioning as a single harmonized unit of function, or are they laminated because of an injury or a disease process, or some type of an insult that has caused a disruption to our normal physiology? So the patient comes in with a complaint, a concern, an injury, an illness, and we put our hands on the patient, and we're actually listening with our hands to the physiology. We're listening for the wholeness of the physiology. And we're sensing and listening to the movement of the prana, the movement of the fluid, the movement of the tissue, for the harmony. And what we find is when there is a disease or an illness or an injury, it will create a pattern in that fluid. If you think back to the picture that we showed that was demonstrated a body of protoplasmic fluid that's ready to receive an image. It's easy to see how an injury would establish a pattern within that fluid. That pattern may be localized to a particular area. Say the injury is in the arm or the shoulder. So the patient comes in and says, well, my shoulder hurts, I fell down, or something fell on the shoulder. And we listen to this tissue, fluid, and potency, and we see that there's a disruption. And it's probably a little bigger than where the pain is. It usually is. So it may include the whole arm, may include part of the chest, but it will have a well-defined shape and form within that fluid that we were looking at. So we'll feel this disruption. And the movement of the prana will be disorganized. Rather than the harmonious flow and movement, there'll be a disorganized movement. And each disease actually has a signature movement. So if it's pneumonia, if it's a virus, if it's an injury, some of that can be distinguished by the way that the prana, the life force, is moving through that disturbed area. It'll be a reduced flow and an unorganized flow. Sometimes the flow will be sort of a side-to-side vibration, quick, fast, side to side. Often we'll see that in the midline, where we have the Ida, the Pingala, and the Sushumna channel rising up through the central canal. The prana should be flowing harmoniously through there, but if there's a systemic illness or a systemic problem, that prana will be vibrating quickly, side to side, really quickly. And the physician can feel it either through the pulses or by listening to the whole of the fluids that we were talking about. Often the patient feels it in themselves. They'll come in and they say, I just feel this flutter in my center, or I feel this palpitation or funny heartbeat in my chest. These are the abnormal motions of the prana and the abnormal motions of the fluid and the tissues as they've laminated, as they become separate from each other and separate from the wholeness of life. So the healing then would be to restore that wholeness, a movement back towards the original form, the perfect form, a movement back towards the wholeness. How do we do that? By pausing. If you watch a child, when they fall down, they don't jump up right away. Children are very, very in tune with the breath of life. And when they fall down or get an injury, they will stop. They'll just lay there. There'll be a pause. They stop. And they wait. What are they waiting for? They're waiting for the breath of life to pass through them, restoring order, restoring the original form. You'll see it in nature too. I once saw a little gecko lizard got attacked by a cat, and the cat grabbed the lizard and shook the lizard all around, and the tail of the lizard fell off and the lizard escaped. It lost its tail, but that's okay because it's going to grow a new one. And the lizard made its way to safety, and it stopped, and it didn't move. It even stopped breathing. You couldn't see any breath, and it was completely still for about 20 minutes. Complete stillness. And the stillness filled the whole room. I sat and watched this whole process in awe. It filled the whole room. I got completely still. And about 20 minutes later, it started breathing. It woke up, it looked around, and it pranced off as if nothing had happened. And I got to watch this lizard for a number of months because it was our neighborhood lizard. And we'd see it every day, and slowly a new tail grew. and it was perfectly happy. So what happened in that stillness? What happened in that pause is a disruption to the fluid, the disruption to the prana, the disruption to the tissues was restored. It moved back to its point of origin. It moved back to its reference point. It returned to its source. It returned to its wholeness. So sometimes in an osteopathic treatment, we will support the prana to come to a stillness. We call it a still point. It's a deep stillness, and the prana comes to rest. So when prana is moving, we could call it attention, and when prana is at rest, we could call it consciousness. So it comes to rest, and the consciousness of the breath of life, which is the original form, enters in to the organism and restores the natural order. And tissue and fluid and prana and the bioelectric field all become one function again. And that's the nature of healing. That's happening in any type of healing modality. That basic principle is happening. If you give a homeopathic remedy, there's a disruption in the movement of the prana. There's a particular vibration. The prana is fluctuating in a abnormal motion or movement. And the remedy that's given has a resonance with that particular fluctuation. So now you have two of them resonating. They cancel each other out. You get a stillness, a restoration of order. The breath of life moves, passes through. And reestablishes the original form, the imago Dei, the perfect form. This perfection is already within you. So everything that's needed to heal is already within you. The job of the physician is to find that perfection, to find that breath of life, to find that perfect form that's already there. Dr. Still, the founder of osteopathy, said anybody can find disease. The true physician finds the health, finds the perfection. So this physiology can be felt. Patients feel it all the time. They feel the changes. They come in reporting these abnormal fluctuations. I feel this little tremble in my center, or I feel like my leg is cold and not moving. And we start a treatment. They feel the warmth come in. We're made to feel this. It sounds extraordinary, but it's actually ordinary. It's what we're made to feel. We're made to feel the breath of life. We're made to feel this prana moving. That's how the Creator made us. So it's actually ordinary. It sounds extraordinary, but it's ordinary. By being ordinary, we're extraordinary. It's very nice. So if you have questions that come up as we're going along, please write them and send them to Rosa, and she will make note. Are we getting any questions coming in, Rosa?
Not yet. So please, everyone, if you
questions.
Yeah.
These talks are sponsored by the Pranada Wellness Center, which is a new initiative of the Kriya Yoga Institute. And the first retreat, the first healing retreat, is going to be in March. There are a couple of openings if you're interested in experiencing, taking this theoretical ideas and experiencing it in your own physiology and your own awareness. We'll be primarily offering osteopathic treatment, Shirodhara treatment, because those two are very complementary to each other. and tridoshic meals, meditation, 3 meditations a day, and some lectures and discussion on health and healing. So part of Pranada Wellness is to empower each person to access their own capacity to heal through knowledge, information, and experience. You have the capacity to heal. These healing forces, these therapeutic forces that we're talking about, I call it the celestial pharmacy, because the prana, the breath of life, is bringing in the moment exactly what each person needs for their healing. There's no 2 treatments in Ayurveda or in osteopathy that are exactly the same. Each treatment is unique. Maybe pull up that, I think it's the 3rd picture that we have for a moment. So that one on the right kind of looks like an osteopathic treatment, except that those therapeutic forces, all those colors, could be coming in anywhere in the body. So this breath of life is passing through everything, creating, sustaining, and destroying. And then during a treatment, it's bringing a therapeutic force, a healing force that will transmutate the stagnation. That's good. We can take that picture down.
We do have a few questions coming in. It sounds like you already answered the first one, which was just asking about what is the celestial pharmacy. I don't know if you want to elaborate any more on that.
Yeah, so the celestial pharmacy is this idea that everything that you need to heal is already within you. And that the breath of life coming from the Creator is passing through everything. And it's bringing a nutritive substance. It's bringing what we need to have radiant health. And it's bringing it in a unique way to each person. So sometimes it'll bring it as a warm heat. Sometimes it'll bring it as a cooling property because a patient may have too much heat already. Sometimes it'll bring a tingling like substance. So there's this breath of life passing through everything and then activating our own prana within us. So we have all this biochemistry going on inside of us. We have all these neurotransmitters, GABA, dopamine, norepinephrine, epinephrine. And when those are in balance, there's radiant health. When those are in balance, there's an ease of communication. There's an ease to our perception. And it becomes a communication with the whole natural world and the whole supernatural world. And this is a natural process that we're made to feel and that we can access. And that's part of what the natural therapies are all about, is putting us into contact with a beautiful pharmacy that's already inside of us. The elixir of life is already inside of us. And it's reformatted and re-established through the breath of life all the time. Especially in the pauses, especially in the pauses of life. So when there's a pause and we stop and we feel it and we acknowledge it, we're actually receiving a communication from the Creator, from the breath of life, from the natural world that is reestablishing our natural order all the time. That's the celestial pharmacy that's available to us. And it's free. And it's going to bring the perfect remedy, the perfect medicine, the perfect prescription at the perfect potency, the perfect dosage, and the perfect timing for everybody all the time. It's a very, very intelligent form of medicine that is more intelligent than any physician on the planet. So inside of you, there is the inner physician. It's your own true self, your own wisdom, which communicates through silence and communicates through pauses. When free to express itself, will create and express the perfect physiology for our well-being, our healing, and our spiritual growth. That's the celestial pharmacy.
Thank you. We have more questions rolling in. Is it okay to keep reading them? The next question from Erica. Should meditation then, as the ultimate type of pause, suffice to cure anything? Is it just a matter of how long one meditates?
That's a beautiful question. And the question shows that the person asking is really in touch with this potential of what the breath of life is bringing us. At the deepest level, yes. The challenge can be to arrive at that level of receptivity. It can be a little challenging because there tends to be just a little bit of willpower in the meditation, a little bit of willpower. And that willpower is preventing the complete imprint of the perfect form. So the meditation will get us right up to the edge. And then we have to drop it all for the healing to happen. It gets us right up to the edge. And then we have to drop even the meditation. We have to drop all of the awareness into the silence from which the breath of life is moving. And then the breath of life will move us into that last little place where the healing will happen at the level that I think the questioner is asking. So the deeper the surrender, the deeper the healing. The deeper the pause, the deeper the silence, the deeper the healing. So there are levels of healing based on the level of silence that we enter into, either through meditation or through a therapeutic modality such as Ayurveda, osteopathic treatment, acupuncture. So yes, at the highest level, it is true, but we sometimes need a little help because partly that's how the world is set up, is we are set up to be in community and help one another. That's compassion. But also, it can be difficult sometimes on our own to move into that last little piece of silence where we receive the complete full imprint of the breath of life. So sometimes when somebody is giving a treatment and helping, that will help because the practitioner or the physician is listening to the silence that's inherent inside of you for you. And that listening creates an augmentation of the silence that sometimes we can't quite get to on our own in meditation. Now we have a practitioner who's providing a service of healing, of supporting the healing that's already happening by synchronizing with a beautiful stillness and silence that's inside of the patient. That synchronization creates an augmentation, and that augmentation then begins to fill up through the whole of the patient. And then the healing can go to a deeper level. That's a really good question, really beautiful. Yes.
Beautiful answer. Thank you. Next question. They're asking, they're saying when they're next to someone, they can feel energies that aren't calm. I feel that my energy starts to synchronize with theirs. How do I stop this from happening?
Accept it. So you're feeling a disruption in their vibration, in the prana, but it's all coming from one source. We have 5 pranas. There's 5 pranas inside of us: prana vayu, udana, samana, apana, vayana, vayanu. And each prana has a specific personality, a specific job, a specific motion, a specific function. But all of those 5 pranas arise from Mahaprana, the breath of life. It's one substance. There's only one substance moving through everything. We're all one. So you're feeling this disruption, and often what happens is you feel this disruption, and then we have an emotional reaction to it, and we say, I don't like that. I don't want to feel that. Well, if you accept it and acknowledge it, and acknowledge that there's also something else there. There's a stillness, there's a silence, and there's a love that's holding even that disruption that you're feeling. You're feeling this lateral movement in the prana. It's moving back and forth. It's usually in the central nervous system, rising up through the central canal. Instead of the prana flowing harmoniously through the Ida, Pingala, and Sushumna, there's this lateral fluctuation. It's vibrating back and forth really quickly. And it feels kind of prickly. It feels kind of hot. It feels kind of uncomfortable. But there's something else that's there too. There's a stillness, there's a silence that's holding that motion. And there's something passing through called the breath of life. That's the oneness that created all of it. So accept it that one, that's what the person needs in the moment to maintain the highest level of organization and health that they can maintain in that moment. So it's an adaptation to keep them alive and keep them healthy. So we accept it and we acknowledge that there's something more. Don't push it away. By pushing it away, it actually makes it stronger. Hear it, feel it, acknowledge it, and acknowledge that there's something more, and that fluctuation, that vibration is connected to the one movement of all of life. That'll help a lot. And it'll help the person find a little bit more peace and calmness in themselves. So you'll actually be providing a service. You'll be helping them in a movement towards wholeness, which is healing. So you'll be supporting their journey in life to healing. Yeah. Nice questions.
We have somebody who is asking about the wellness retreat in March, asking if there's going to be anything this fall or winter after the retreat. I don't think we know the answer to that yet. I think we're going to see how the first retreat goes. And I'll be posting a link to that after the talk. After we get through some of these questions, I'll post a link. Again, there are a couple spots left in the wellness retreat. It's going to be March 31st through April 4th at the Temple of Compassion. It's going to be a beautiful experience. So I'll post a link to that soon. The next question for Olixn is from Madhan. And they're asking, if 70% of the body is fluid, then can this holistic healing approach heal someone suffering with acute hip joint arthritis, especially when the person is born with a congenital disability, such as hip dislocation?
Yeah, congenital dysplasia of the hip usually will require a surgical intervention. Depends on when it is evaluated or found, when the treatment is started. We never want to put a limitation on the capacity for healing to happen. So usually we'll treat anything 3 times, and sometimes we see some miraculous things happen. But sometimes congenital abnormalities of the joints will require a surgical intervention. And surgery is part of medicine, and sometimes is a necessary part of the healing arts, is to use the scalpel when it's necessary. When I see patients, almost any concern or complaint, we'll give it 3 treatments. And if we're making progress, we'll continue on. If we're not, we'll look at other approaches or other interventions or needs.
Thank you. Next question, can the use of frequencies via music or tones assist in the healing process, considering the challenge of getting to that place of perfect healing via meditation?
I didn't hear you well. Can you repeat it a little louder?
Yeah, Trisha's asking, can the use of frequencies like music and tones assist in the process to getting to the place of perfect healing, if it's not possible through meditation?
Yes, sound and music and frequencies are very beautiful and have a very profound effect on these vibrations and these fluids that we're talking about. Very, very, very powerful. There's a really good book, I believe it's called The Music of Life, and it's written by a Sufi musician and healer. And he goes into a lot of detail on the effect of music, sound, vibration on the fluids and the tissues and the pranic energy. Light, sound, and vibration are the healing forces. Light, sound, and vibration are the backbone of the celestial pharmacy. Definitely.
Okay. Next question. Where does surrendering to the death of the body form play out in healing? Being 86 years old and having been pondering this since I've suffered a few strokes. They're also asking, will this be recorded? It will. All of these talks will be uploaded to the Prana Wellness YouTube channel, which I'll put in the chat as well. So surrendering the body, how does that play a role in healing?
Yes, this is an important topic because it's important and it's essential actually to healing to remember and recognize we're not the body. the body is the vehicle for our experience of the physical world. It's the vehicle for our experience of joy and suffering. The body essentially is made up of the 5 gross elements, and it's the vehicle, but we're not the body, and our over-identification with the body being us is part of the disease process. It's part of the root cause of disease. So it's very important to recognize that we have a responsibility to take care of the body, to honor the body and recognize it as the temple of the divine. But we're not the body. And at some point, we'll have the opportunity to leave the body. Dr. Still, the founder of osteopathy, had a beautiful saying. He said, the body is the second placenta. I really like that. The body is the second placenta. You think of the function of the placenta is to bring a food and a nutritive substance to the embryo for growth and development. Then this body is a nutritive substance for the growth and development, for our spiritual growth and development, for our journey back to our true self, which is healing. So it's a very, very important point that she brings up, is remembering we're not the body, we're not the mind, we're not the prana, but we're the omnipresent, omnipotent consciousness aware of all of this phenomenon. And the sense of that comes more strongly when we're in tune with the breath of life, with the movement of life. And again, that comes back to the pauses. When there's a pause, when there's a natural pause, we stop, wait, listen. And in that listening emerges the meaning of the moment, emerges the identity of who I am in the moment, the physiology that's needed in the body for that moment, and the whole meaning of that moment comes and then passes through, and then a new pause. And that's how life continues to emerge through us, passing through us all the time. We're not the body. The body's a gift, and we want to take good care of it. And one day we'll have the opportunity to leave it. Thank you.
Next is a follow-up question from a question that was asked earlier about feeling other people's energies. Let's see. So how can we maintain a peaceful state when we are surrounded by uncalm energies?
How can you maintain a peaceful state? What was the last part?
When we are surrounded by uncalm energies.
You're always surrounded by the breath of life, which is the calming energy and the source of all. You're always surrounded by that. It's always passing through everything. So whatever frequency or movement of the prana you're experiencing in the moment, accept it, acknowledge it, and ask what else? What else is there? Because there's something more that's there than what's being perceived in the moment. All of these movements, all of these different harmonizations, all of these different frequencies, all come from one source. There's only one. There's only one breath of life. There's only one substance to life. which then creates multiplicity and diversity. It's our identification, our over-identification with the multiplicity and the diversity that causes the trouble. Remember, acknowledge, and listen for the oneness that's passing through everything, creating and sustaining all of this multiplicity. It's all one substance. So you're always embraced by the breath of life, by Mahaprana, by Prana Krishna. You're never not. You couldn't breathe, you couldn't move, you couldn't think, you couldn't perceive if it wasn't true, if it wasn't there. If you're breathing, perceiving, thinking, this is an effect of Krishna Prana. This is an effect of Mahaprana, the great prana, the breath of life. So acknowledge that truth, listen for that truth, accept that truth. That's what they call in the spiritual traditions and in spiritual practice and in sadhana, faith. And in the Bhagavad Gita, it tells us, man is made of faith. Whatever faith he has, thus he is. So how much faith do you really have in the breath of life? It's easy to say, yes, I believe there's one substance. Yes, there's a breath of life. If it's so, if you really believe, then it's in everything you're looking at. Everything you're perceiving is divine. It's in your oatmeal, it's in your eggs, it's in your neighbor, it's in your dog, it's in your cat, it's in your wife. It's in you, it's in your breath, it's in your perception, it's everywhere. The movement of life, the breath of life, Mahaprana is passing through everything all the time. If you felt it once, it's enough because it's in an eternal memory. Even if I don't feel it on a particular day, acknowledge it as truth and live as if. Then these other vibrations, frequencies, will give no problem. They're just part of the symphony of life. They're just part of the big music of life. They're all part of the same thing. Sometimes when I work in the emergency room, it's total chaos. People are throwing up, people are sick, people this, that, there's noise, chaos, there's all these different frequencies. But sometimes we feel the breath of life stronger in that environment than in church or a meditation hall, because it's an essential truth. It's the movement of life. It's one substance that creates the multiplicity, diversity. So if you feel these disruptions and they're giving you trouble, just remember, it's all coming from one source, and listen more deeply. Listen to what's passing through and holding, sustaining, and creating all of it. It won't give you any trouble. It's beautiful. It's one substance. Live as if it's one substance. Acknowledge it as one substance. It'll be very easy then to see the divine in your neighbor, to see the health and the perfection in your neighbor, in your spouse, and even in your enemies. Yes, thank you.
Thank you. We have a question about sort of about the retreat. They're asking, can chronic foot, ankle, and muscle pain be considered for treatment at the retreat?
Chronic what?
Foot and muscle pain. Foot, ankle, and muscle pain.
Yeah, most pain is a result of a disruption in the flow of the prana and leading to inflammatory process. So it can be the life force is flowing too much or too strong, which then is pushing the pitta, causing heat and inflammation. It can be that the prana is not flowing well enough, so there can be too little flow of prana, or it can be a displaced prana or an abnormal flow of prana. So these are pain, fibromyalgia, chronic pain, arthritis, come back to the imbalance in the flow of the life force, the imbalance in the flow of the prana. And then we have to evaluate and see, is it too little, too much, displaced, or irregular? That's then leading to either poor circulation or too much heat, which then would lead to inflammation. So the pain could be from heat, cold, can be from too much flow, too little flow, irregular flow. So we evaluate that and try to support a state of balance, and then allow the body to bring its natural corrective healing forces in, allowing the celestial pharmacy to express itself at its greatest potential. Yes.
Thank you. Next, I hope I get this term right. Can ankylosing spondylitis be healed? Is that a disorder you're familiar with?
Ankylosing spondylitis is essentially an autoimmune process involving inflammation. It can be healed. It definitely can be improved. It requires quite a few things that need to be addressed. Panchakarma is very beneficial for ankylosing spondylitis because we need to clear out the ama, or the toxins. So there needs to be a cleansing program. And then we need to look at the diet and the food that's being taken in. And then we need to look at the treatment options to restore the normal flow and motion throughout the whole organism, and particularly in the lumbosacral spine, and address the inflammatory process. So I've seen a lot of improvement in ankylosing spondylitis over time. I've seen people get off of their medications. Generally speaking, the patient needs to be careful with their lifestyle throughout their life, because there is a vulnerability there that can flare up when there's too much stress or improper diet, or conditions that can cause inflammation or stress. Multidisciplinary approach: cleansing, diet, rest, rejuvenation, and I would use osteopathic treatment. Other modalities could also be used. Ayurveda is very helpful. The herbs are good for cleansing and clearing the channels, good for anti-inflammatory, and getting the toxins out of the body is essential for resetting the natural balance of the immune system, which is, as we've discussed in previous top lectures or discourses, is a function of perception. And when there's toxins in the body, in the blood, in the channels, the perception is clouded, and the immune system then doesn't function optimally. Yes, it can be healed.
Thank you. Next question from Suresh. Is Maha Prana the same as consciousness?
No, it's not. Consciousness comes from the soul, Sat Chitananda, existence, consciousness, and bliss. Prana is an effect of the soul and the movement of life coming from the soul. When prana is moving, that would be our attention. When prana comes to rest, or a still point, or a pause, then the consciousness comes to the foreground from the background. It's not the same thing, but they're connected.
Thank you. Next question is another a medical question about double vision. Can double vision be healed?
Yes, well, we would have to know the cause of the double vision. There's many things that can cause double vision. So again, that's in that case, it's going to come down to the cause. Is it in the lens? Is it in the retina? Is it in the pathways that the prana uses to flow through the nerve channels to the back of the brain into the cerebellum? I would be hesitant to say yes or no. Double vision in some circumstances can be healed depending on the cause. There are some causes that would require a surgical correction to the lens. There are some causes that could be coming from disruption in the back of the brain, in the cerebellum. There are some causes that are a simple disruption of the flow of the prana through the eyes, through the nerve pathways, crossing at the optic chiasm of the pituitary, and then moving into the vision centers in the back of the brain. So sometimes a restoration of the natural balance of the whole of the patient and the whole of the flow of the prana will improve double vision. Sometimes a corrective lens will help, but sometimes there's other organic causes that could be more difficult to treat. Without knowing the cause, more difficult to say. Yes and no.
Thank you. It looks like that's the end of our questions. Lots of people just expressing their gratitude for you and how helpful this talk is for them. This might be a good time to talk a little bit about the retreat and what to expect there. I'm going to post a link in the chat now. Anybody who's interested in looking at that can follow that link and read more about it and learn how to sign up if you want to share anything about that.
Yes, so it's been a pleasure to spend some time with you and discuss these beautiful topics that comes from a very ancient knowledge and wisdom and perception that is a gift to humanity for the upliftment and wellness of humanity. And sharing this knowledge with each other and amongst ourselves brings deeper understanding to everyone, which brings greater awareness and potential for healing, which is our movement back to the true self. In a sense, you could say the whole of life is a journey of healing. The wellness retreat will be in March, sponsored by Pranada Wellness Center, and it will be putting some of these principles into practical application so that the participants can feel it in their own bodies, experience it in their own awareness, and have more tools and resources available to access their own inner physician, their own inner capacity for healing and wellness. The emphasis of the program is wellness, rest and rejuvenation. And the Shirodhara treatments and the osteopathic treatments are very complementary to support a balance in the nervous system, a balance in the pranic flow and the pranic energy, which on its own will bring about a movement of healing and wholeness, whatever the symptom is. So we're not so focused on particular symptoms, we're more focused on the movement towards wholeness, the movement towards the true self.
Thank you. If anybody has questions about the retreat, we have a few minutes left. We can answer those. Lots of people just again sharing their gratitude for your work, Olixn, for your generosity and your seva.
The gratitude is mutual. thank you to everyone for your interest and your commitment to the well-being of yourself, your family, your loved ones, and humanity.
All right, last call for questions. This might be a good time to wrap up the talk time. Any closing words? Thank you everyone for coming. All of these recordings will be available on the YouTube channel that was posted in the chat earlier, and I'm going to repost it now for those of you who missed it. And it's our plan to have more lectures like this from Olixn and other physicians and healers regularly as an offering from the Wellness Center. So please stay tuned for more. And
if there's any topics you'd like to hear on, you can send a message to Rosa or an email to Prana Wellness Center. We'll try to speak to what you're most interested in.
Yeah. Thank you so much. We have one question we didn't get to. It's about total surrender. If total surrender should result in perfect health, why do Paramahamsas get sick? And this person also wants to know why there is an X in your name.
What was the? I didn't really hear the first part of the question.
Maybe why do self-realized people get sick, for example, if surrender, if it's all about surrender? It's a big question. We don't have to answer it today.
So a self-realized person still has a body, though they're not identified with the body as being them. They are permanently established in the awareness of who they are and their true nature and their true self. But the body still is subject to the laws of the natural world and will be exposed to all the different environments, influences of the natural world, which can cause subtle imbalances. Additionally, sometimes the masters are expressing karmas of their devotees and their students through the body. To speculate on a master is a difficult area to tread on. The reality in which they live is extraordinary, though ordinary. And the body will still have certain karmas to express, perhaps through their students, and is still subject to the incarnation that it was designed to go through. So there's many reasons a master or anybody can become sick. And sometimes in ourselves, in a non-realized person, the illness is the fuel to the wholeness. The illness is the fire that moves us into healing, that moves us into the wholeness of life. So illness is essential to life. And in ourselves, it expresses sometimes an imbalance, but it's also the fire that's generating the spiritual journey. Fever is a transmutative process. Fever is a fire that's burning away not only ama and toxins, but burning away perceptions that aren't in alignment with the true nature of who we are and the wholeness of life. So you see people go through illness, and on the other side, they're lighter, they're more aware, they're more in tune with the natural movement of life. Now, to speculate on how a realized master is sick and why is very difficult, because there can be so many reasons. But generally, and at some point, the body has to be given up anyways. The master wants to return to his beloved, so the body needs a reason to, needs a way and a reason to die, for the breath to leave, and the pranas to return to their source, and the five elements to return to their source. There needs to be a doorway for that to happen. They don't want to be here forever. Many reasons that can be. I would be cautious in offering too much speculation on the nature of a realized master.
Thank you so much again, Olixn. Thank you everyone for joining us. Again, we have a few spots open at the wellness retreat at the Temple of Compassion. It's going to be a transformative experience. Olixn will be one of our physicians there. If you've ever had an osteopathic treatment with him, you know how powerful it is and how healing it is. So yeah, we encourage you to sign up. We'll be running a wait list too, since we only have a few spots left. But things happen, people drop out, so there might be an opportunity for you to be there if you wish to. Again, thank you so much, everyone, for coming. Thank you, Olixn, for just sharing your wisdom with all of us so generously, being such an instrument of peace in the world. Thank you so much. Hand it off to you for any last words.
Thank you, everyone.